My son recently had surgery at our local hospital. The care was great, but the expense was exorbitant. And it was about $46,000. That same procedure at Surgery Center of Oklahoma, $8,000.
And to be clear, because a lot of times when I will give these as example, people will say, yeah, but because they don't have to comply with the government stuff, the quality is not as good. That's not true. They actually tend to, if you look at the actual reviews from the people who have used those services, they're much higher. The reason for the reduction of costs isn't because they're cutting corners or doing things worse. It's just the opposite. It's because there wasn't 1,000 people between you and that doctor providing the care that have to get paid. That's where the costs are. When you are sitting in front of your doctor and they're saying, well, you've got to do this and this and this, you don't see it in that moment, but in between you are thousands of people whose salaries have to be paid because they are taking their part in the bureaucracy. You remove that bureaucracy and have it where the only person getting paid there is the doctor and whoever's the nurses that are helping them, and they're paying for whatever products and materials they need or whatever to do the services. Now, instead of there being thousands of people or hundreds of people between you and the doctor, now it's just you and the doctor and the handful of staff that work for them.
And actually, you're right. The service would be better. And here's my argument when you have a third party involved, any kind of insurance, government insurance, let's just call it what it is. Anytime you have a third party involved, that third party's paying the bill. Do you think that entity, that healthcare entity, cares about the patient as much as they care about the third party paying the bill? Let's think about that. The third party is the customer. They're the ones paying the bill.